We're learning more information about a case of measles confirmed in Pueblo this week. The Department of Public Health says it has found a third location where people may have been exposed to the measles virus. The new location is the Southside Walmart on Northern Avenue. The exposure was the highest for people who were in or near the pharmacy on Saturday, March 22nd from 2:30 to 5 p.m. As we've reported, the other locations for potential exposure were the Southwest Deli and Cafe and the Southern Colorado Clinic in Pueblo West. This comes after the health department confirmed Monday an unvaccinated adult man had the measles. The health department reports the Pueblo resident had recently traveled to an area of Mexico experiencing a measles outbreak. News 5's Eleanor Sheehan spoke with one mom in Pueblo who's taking precautions to keep her kids safe.
At nearly 8 months old, children like Danae's son are too young to get the measles vaccine.
Measles is a scary disease.
The CDC recommends all children get 2 doses of MMR, measles, mumps, rubella vaccine, the first one at a year old.
You know that your child is not going to be protected because they're not of the age to be able to get the vaccine yet. So you just start scrambling in your mind of, do we stay inside? Do we not take them anywhere? What do we do? How do we keep them safe? And it just really reminded me a lot of COVID and being on lockdown again.
When Danae heard a case of measles was confirmed in Pueblo, she began taking precautions.
I think as a parent who wants to do anything to keep their children safe, the idea of either secluding him, keeping him away from everybody, possibly getting him an early vaccine, all of the options were on the table to figure out how to keep him safe.
She says they're spending more time at home and avoiding public places.
Every mother's worst nightmare, every parent's worst nightmare is something happening to your child that you can't fix, that you can't do anything about.
Danae's son was born premature and spent several days in the NICU at Parkview Medical Center in Pueblo.
So we're already on high alert about making sure that we're taking care of their immune system. And now there's a case here in Pueblo. If he got measles, what would that mean for him and his immune system? And it's a scary thought to think about what could happen to him.
So Danae checked in with her children's pediatrician and recommends others do the same. Pediatricians recommend parents avoid areas with known outbreaks and people who are sick, limit babies' exposure, and continue to wash your hands frequently. Measles symptoms include fever, cough, runny nose, red eyes, and a rash that usually starts several days later on the face and spreads. If you develop symptoms, the Department of Public Health says you should immediately call your health provider. Public Health says anyone who was at these locations during these times may have been exposed and should monitor symptoms for 21 days. In Pueblo, Eleanor Sheehan, News 5.
Eleanor, thank you. The measles outbreak began in West Texas back in late January. As we mentioned, though, the case in Colorado stems from Mexico, not from Texas. Here's a look at the latest numbers from the CDC. There have been 483 confirmed cases in the U.S. For context, there were 285 cases in all of 2024. Unvaccinated patients account for 97% of all cases this year.